People who work in the NHS are under huge pressure all the time, and it was very intriguing how many people were really keen to get to know about this mindfulness thing as a way of dealing not so much with the patient, although that comes into it, as coping with their own pressures and stresses and strains.
Well, mindfulness really is a translation of an ancient word that means awareness. And when you call it awareness, it's obvious that we're all aware some of the time, but quite mindless other parts of the time. So mindfulness is a way of practicing how to become more aware by learning to pay attention moment by moment, intentionally, without lots of harsh self-judgment all the time. There's an experiment in psychology called the pink elephant experiment. Try to not think of a pink elephant for a minute. And people can't do it because they're trying to think of not what they're supposed to be thinking. And I think our thoughts and feelings and difficult feelings are like that they tend to keep trying to get in. It turns out that if you have the strength and the courage to allow them in, sometimes they come in and then they leave of their own accord, and that's a huge relief that you didn't have to control everything all the time.
I think what they'll take away is, how does this mindfulness thing work for me, and what's the next step? And that's one of the things that we as the organisers at the end have to think about, because there's got to be follow-up to this. That's very clear.
When people feel so pressured, when there's so little resources around, yourself, your body, is one of the few resources you've got, and therefore looking after it is very important, and people are beginning to realise that. And that's why I think there's so much hunger to learn the so-called simple thing of taking spaces, and letting go of multitasking, and really seeing how much energy is consumed that we don't actually need to expend. And that then releases it for the things you'd really like to do, to nourish yourself more than we usually do.